be the moderator. So I would like to call on maybe to please turn on his camera, and Olivia as well, you can stay on, so that, and then I'll call on Israel Ayodele. He's the head of product for HealthXP. He would be moderating this panel session. And every other person, please, if you have a question, please feel free to drop your questions in the chat section. And if you would like to ask your question yourself, you'd like to just use the raise hand icon there, and then emoji, and then I would only allow your mic to speak, allow you to speak, and then you can ask your questions. So thank you very much, Israel. Thank you so much. Over to you, Israel.
Hi, thank you very much, Comfort. Good afternoon, everybody from Nigeria. If you're not in Nigeria right now, good day to you. Hello, Dumebi. Hi, Olivia. Nice to have you on this panel session. Thank you so much for an insightful presentation that you both made. So we do not have a lot of time, but then I would like to, first of all, Olivia, you mentioned you gave out a lot of terminologies and a lot of terms that at some point I was trying to grasp some of those things, and I'm sure that a lot of people will also want to get to understand these things. So if you have questions, just as Comfort mentioned, if you have any question, maybe you need more clarification on some of the terms that you mentioned, and you'd like her to give some more explanations to some of those terms, please drop your questions in the Q&A section of this webinar, or you can drop on the comment section here. So I think I'd like to go first and ask Olivia, because you just finished your own presentation. So you mentioned a number of solutions, open source solutions that can be implemented or that your organization is working on. And you also mentioned the government policy part, which was quite interesting to me. So I know you worked a little bit in Africa, South Africa, I think, and you're a registered nurse as well. So you've seen how this how the healthcare system works, not just from the technology part now, but in the real hospital worlds, or in the real sense of, you know, how healthcare can work. You've experienced that. So in Africa, because we're directing this back to Africa and back home, and you also mentioned that there are some places in the US where there's still need for advancement. So what would you say are the first strategies that can be adopted in terms of, you know, opening up collaborative effort? Because apparently the government policies are not just sufficient to solve this problems. And in Africa, we have a lot of healthcare system challenges that we all are trying to figure out. So what are the key things that you would say in terms of collaborative effort between private organizations and public organizations? What should be the first or the major thing that should be worked on for these underserved regions to get the best healthcare solutions? Thank you.
Yeah, so one, let me preface by saying I definitely don't have all the answers, and I don't think anybody does.
Yeah, I understand.
And every country is very different in their approach of how they're doing it. So I think some of the key things that we look at, or that the recommendations that you see coming from WHO or other organizations is, you know, do you have a costed digital health strategy for the country, right? Like, so not only saying like, here's the overall enterprise architecture that you want in a country, all the components, kind of, it could be like the open HAE model, it could be a different model, but here's all the models. Here is the money you need to actually do it. And here's the resources that you need. Like, even just starting there and knowing that information is really important. I think looking at models that have been successful, especially in settings where there's a lot of rural regions and a lot of variation in access to digital and to digital technologies. A good example is India. So India is it's its own subcontinent. It's huge, right? There's a lot of variations And they've developed this whole digital sandbox, which kind of speaks to what I was talking about, where you can come in as an innovator and plug and play into the government's digital sandbox. And a lot of the systems and the components that I was talking about are there and available to pull data from. It's not without its challenges, and I think particularly, the needs of patients in the public sector versus the needs of the patients in the private sector, there isn't necessarily like an overlap. So you may have, some kind of app that you've developed for the public sector, and then, you realize, yeah, that's great, you're helping the public sector, but nobody's actually funding you to help the public sector. So now, okay, I'm going to make money by offering this to the private sector, but it requires almost a complete remodeling of your tool, because the services and the needs are different. So that's part of the challenge. So I think having mechanisms to help entrepreneurs think through that process, giving them support, having startup funds, giving money to experiment, having social venture capitalists come in and say, hey, this is like going to benefit all of society, and that's why we're doing it, not for like immediate return on investment. So I think the combination of those things and getting the governance and the processes in place, like how is the government supporting entrepreneurs? How are they helping them? How are they making the space easier for them? I think by having support for these DPIs and helping to lower the development costs is really a start.
Thank you so much. Thank you so much for sharing that. I'd like to also mention again, if you're just joining or perhaps you didn't hear me before, please drop your questions in the chat section, and also you can drop in the Q&A section, and we'll read them out. You can also please direct, if you are directing to any of the speakers, please just direct to this person so that I will know who to ask and we can continue. So thank you so much for sharing, Olivia. So I just have one more question for you before I ask Dumebi questions as well. So I want to understand, you already mentioned a number of solutions that your organization is working on, and I'm sure that you've worked across several other organizations on several projects and initiatives in the US and probably in some other countries. So for Africa, I'll paint a scenario as some of the problems that we're trying to fight or trying to find solutions to in Africa is the connectivity issue that you mentioned. So where more than 60% of the entire population does not have instant access to high-speed internet, or even doesn't have access to connectivity of any structure or sort at all. So what are the solutions that are currently available, or have you worked on, or maybe your organization, or that in the US, perhaps maybe you've seen any that African organizations or African government that are trying to create solutions can leverage on, work with, probably reach out for collaboration. So what are those technologies or solutions that can be useful to us in Africa at this point?
Yeah, so there's two great places to look for those, and when I'm done talking, I'll put links in the chat. But one is the Digital Public Goods Alliance, and the other is the Global Goods list that comes out of Digital Square. And so if you look at both of those lists, it has certified open source tools that are designed specifically to work in low resource settings. So they have a component of maybe working offline or working with limited bandwidth, or I know like our registry, we just recently adapted it to deal with frequent power outages.
Wow, that's great.
So you can see a lot of tools that are available like that. It depends on the particular use case. Off of my head, some that come to mind are Medic Mobile and ComCare, which are both frontline tools for like community health workers for supportive supervision or clinical decision support. They work on, a very basic mobile phone and allow a community health worker to kind of step through care protocols, but they don't necessarily need to be connected to the internet. And then they can just once they can find a signal, like they get a Wi-Fi signal, 20 miles away, 50 miles away, then they can transmit the data. So there's a lot of tools that work in that manner, but I'm happy to share those 2 links because there's obviously like hundreds of tools, and I'd be talking for quite a bit, and I want to hear from Dumebi too.
Yeah, that would be great. I'll get to Dumebi in a second. I know he has first-hand experience and he has worked on a number of projects too in Nigeria and in Africa as a whole. So Samuel is asking you a question, Olivia. How does one contribute to the open source project? Is there an official GitHub page that we can check out? I'm sure that's a question from a developer. So do you have
and
any?
I'm so grateful for people who want to contribute. So yeah,
Yeah.
so all of IntraHealth tools have GitHub pages, and I'm pretty sure that that's a requirement to be registered by the Digital Public Goods Alliance, that you have a GitHub page where you can contribute to. So OpenMRS and some of the other tools that I've mentioned all have pages where you can contribute. So you can go to them and check this out. I think Amy just put a link to the Digital Public Goods Registry. So from there, you should be able to find all of them. And we each have our own community managers that help accept new code changes or new feature sets, and anything like that. But we're always looking for people who want to contribute, and welcome that support and help.
Thank you so much. Thank you very much for sharing. So I would like to ask Dumebi some questions now. Dumebi, I know that your background and a lot of experience in data, in research, and I know that your current company, you help organizations map some of this data insight that they might require. So I know you are also a Nigerian. You've been in Nigeria a lot of times, and you understand that some of the current problems, or one of the major problems in terms of access or data, is access and equity in terms of getting what data in particular that you need, and it's available to everybody. So what are the instant solutions that you think can be adopted, maybe through partnerships, public-private partnerships, or even private partnerships, to enhance that access and that equity, to make it affordable too? Because another problem is that data management or acquisition of data in Africa, in Nigeria, and some of the other African nations is quite expensive. So what are the instant fixes that you think can be applied to get easy access and equity for data? Thank you.
Yeah, thanks for that. Yeah, that's a good question. So the technology is there. Yeah, the ability for us to, even a country as big as Nigeria, is easy for us to be able to warehouse this information and leverage it. If you mentioned that a few times. I think the challenge is actually not technical, it's actually, should I say, political? Because I think there needs to be a deliberate effort to have or have institutions, whether public or private, to consolidate all the information on patients and have that accessible to the patients, and with their consent, accessible to third parties. Because I think that's when innovation gets exciting. But I can see, to be transparent and also to be realistic, I can see that being very challenging. I mean, you imagine being a public hospital. And to Olivia's point as well, they may not necessarily be well funded to set up a digital infrastructure. It's very difficult, very, very difficult. Particularly in our market, because there's also a major skill gap in many areas of data. So it has to be something that is deliberate. It has to be something that is planned and put in place over sort of a extended period of time. But I think there are even small wins that could happen now. I mean, you don't necessarily need to have someone's entire history. We can start from scratch. Any time that there is some medical consultancy or medical examination done, have that somewhere and start building that over time. Kind of like what people are doing now with credit rating and their KYC documents. Have that starting from scratch. So I guess it's just a case of perhaps the private sector, public sector, entrepreneurs, innovators, to come together and make that push, or perhaps maybe start off in a very niche area, and start to maybe, because a lot of private sector have been doing that. You see that quite often in Nigeria, where they're creating warehouses of data for many purposes. Perhaps having a deliberate attempt at doing that for healthcare data, and having that then start to expose the country and people to the benefits of having your data accessible to you and to other third parties. So yeah, it's a combination of perhaps private individuals or entrepreneurs coming together, and also even supported by the public sector or by government, to really have that initiative put together, because it's important and it will happen. And it needs to start now, as soon as possible.
Thank you so much. Thank you so much. I have another question. Before I ask my question, if you have any question for Dumebi, if you're a developer in the house as well, or on the session, you would like to ask specific questions, very technical, please drop your questions in the comment section or in the Q&A section, and we'll put that together and they'll be treated. So to my next question, I want to ask about, you already mentioned how there could be public-private partnerships to make this effective. But then we're looking at scalability and sustainability for the structures, because you already mentioned that for, let's say, for hospitals that are government funded, there is little or nothing they can do to even start a system that can help them acquire the data that they need. But then for you also mentioned the KYC process and the credit infrastructure that is currently developing in the continent as a whole. And it is a lot of investment and a lot of technical skills that has to be committed to that. But then looking at healthcare and the challenges that we're faced over the years, and probably a lot of organizations have attempted this and maybe failed at some point. So scalability and sustainability, what would you advise as the go-to to achieve this? If a private organization is going to attempt this, if a public organization is going to work together, what should be the focus in terms of achieving scalability and sustainability?
Oh, that's a tricky one. So obviously the major challenge, as I said already, is the technical skills.
Yeah.
Don't forget, it's also operational. The hospital will need systems in place to collect information, to record information, to share information. And again, that can be very time consuming and difficult.
Yeah.
If I was to perceive a shortcut to that, then it would be a private institution setting up that infrastructure, and then perhaps providing the hospitals a very simple medium to access and to share that information. You can do that, quite easily, if you register hospitals and have the whether the doctors or the nurses or any medical professionals there with an app or smartphone, and being able to log information about a particular customer, and then having that shared with some third-party infrastructure. That's very possible. I mean, I can see there being, I think that if it was positioned that way, the main challenge would be getting buy-in. Some hospitals and doctors would point blank say, my job is to treat this patient. I haven't got the time to log information and access systems. There will be some pushback. So again, what would help win that over is if it can also show long term that it can actually help the patient, even help the hospital, because if the hospital can see history, then that could help with diagnosis. And if they all share that information, then it benefits them and other doctors, and also the patient as well, because the patient can then, whether they're moving or they travel or whether they pass on, that information is there and can be benefited and leveraged by them or by their children and their families. So I would probably align that more to education and probably the right campaign, the right incentives. You could incentivize this behavior by providing some kind of cash reward for collecting data, because it's data. Data is money to some degree. So, if this private institution has the ability to do that, that could really help. But yeah, it's a lot of work. And to your point, I have actually seen in this market people try, and I don't see it manifest quickly, because I think a lot of these companies that do try to do this, and I think it's a great initiative, do struggle because they still need that support. And but I think what was great about COVID, I come back to that, is that it exposed a lot of the weaknesses in what we have in data. Being able to communicate with massive amounts of people, being able to understand who has symptoms and how to find information and what to do about it. I think when that was going on, that's when I started to see a lot of these health tech sort of shoot up and look at what they can do with data and how that data can be used to support people. So I think with time, as we start seeing a lot of these technologies being useful, it will quite naturally shift in that direction. But there's a lot of work to do, but a great power and great benefit when that comes into play. Like Olivia said earlier, and I completely agree with that. With that data in place, what the prospects of innovation within healthcare is just it's uncomparable when it comes to access to information, access to diagnosis, access to treatment, access to medication, access to insurance. I mean, the list of benefits are extensive. So it's a no-brainer that the effort one puts in to get there is worth it. It's just a case of really, having sort of that long-term. I think that's the issue: long-term vision, and seeing the long-term benefit it can have to a community.
Thank you so much. So to wrap this up, I'm bringing this to a close. So you talked about vision already. So for you personally, as a data scientist, a data pioneer, so to say, in Africa, in Nigeria, what would you say, or what are your visions for big data, artificial intelligence, data management and gathering and acquisition for the entire continent? What are your visions, or what do you think should be the key things to focus on moving forward?
Yeah, I perceive there will be a major push in the private sector. It always kind of starts that way in our market, right? And I can see growth in data technology, data innovation, not just in healthcare, but in all sectors. And for data to have a more transparent currency. I provide data. I have the ability for it to be governed the way I want it to be. And if it's leveraged with my consent, I do have some benefit to that leverage. I can see that becoming quite a popular instrument going forward. I mean, now there's data everywhere. It's just that it's not very smartly collected and provided access. And eventually, people will find clever ways to get data that is fairly available and pull it into one central location and be leveraged. And individuals like you and I would then be able to access that data and then leverage it for our benefit, amongst other things. So that's I see that being where things are heading in emerging markets like ours, where particularly when we get much better at data governance, more data at data management, more data consent management, being able to extend that service to third parties, to innovation companies, to entrepreneurs, to find clever ways to leverage that data and help make people's lives better. So that's kind of where I see it going.
Thank you so much. Thank you so much. We are 10 minutes over time. So Olivia, just in about a minute, future directions. You probably have a lot to say, but future directions for Africa, for underdeveloped regions, and also for the areas that are not covered yet in the United States. What are your visions, or what do you think should be highlighted first and should be focused on moving forward?
Yeah, so I think, related to what Demebi said, making data more accessible, easier to use. I think everybody should benefit from, future technologies, whether it's AI or precision medicine. It shouldn't matter where you are. I think promoting entrepreneurship, particularly in Africa, so that these are, African solutions for Africans, developed and customized to your setting and part of your ecosystem. You have control over it, the government has control over it, and it's not dependent on an outside entity. I think it's going to be really important, and I think that's going to require capacity building, as was said previously. There's a shortage of data scientists, there's a shortage of software developers, there's a shortage of security specialists. So I think, as we see capacity developing initiatives and funding being poured in, that hopefully that'll go towards real innovation that works effectively to really get people equitable healthcare where they are.
Thank you so much. Thank you so much for sharing your insights today. And thank you for engaging in this panel session. I am sure that everyone on the session today learned a lot. And from you, maybe I picked out education and education for the target audience, for the market. And then Olivia, I picked from you data being made available, access and equity to everyone that actually needs it, particularly in the healthcare industry. Thank you so much for sharing your insights with us today.